Okay, for today's meeting, we're going to go through Care Standards 1 at the Practice. Now, this basically discusses policies, such as those relating to patient focus, patient complaints, policies and procedures, treatment planning and estimates, clinical effectiveness and evidence-based dentistry, appointment book management and cancellation policies, referrals to other practitioners and what to do with sepsis, prevention and public health activities at the practice, and also whistleblowing and fitness to practice. Now, policies related to patient focus. Now, these are the policies that put the patients at the heart of everything we do. So, quality assurance and cross-infection control, that would be the checks, say, for example, the 6-monthly IPS audits we do. Consistent quality provided treatments, they're things making sure that we're using really good quality materials, using rubber dam, for example, for root canal treatment, and also making sure that the dentists and nurses are all up to date with their knowledge. We need to comply with all the health and safety laws of the practice. Use x-rays safely. Now, using x-rays safely, that would include things making sure the justification's there correctly for taking the x-rays in the first place. When we do take x-rays, we keep the dosage to the patients as low as possible. We use beam aiming devices to make sure the quality of the x-rays are really good. Once we've taken the x-rays, we take time to review those x-rays and implement any changes to treatment based on those findings. Now, next bit is obviously complying with Gdc requirements. Now, that includes things like continuing professional development. We learn from errors. Everyone obviously makes mistakes, does things well, does things not so well, but ultimately it's always about reflection and improvement on those items. We use guidelines such as the NICE and also the Scottish guidelines to help our clinical decision making. We have a policy of minimal intervention wherever possible, so if we can do a small intervention for the patient which has got a good outcome, that'd be far better than doing a major treatment plan. We'll never refuse treatment on the grounds of race, gender, age, disability, sexual orientation or religious beliefs, and our fees are designed to be fair. We operate robust complaints procedures and obviously actively welcome comments about the service that we provide for patients. Now, how are we going to basically achieve this patient focus? So we need to make sure that patients and visitors feel welcomed and informed. We need to treat people with the dignity and respect. Work towards improving health equalities. Now, that can basically be in the practice. That's also basically delivering oral health in the community through the primary schools, etc. Work towards improving access and waiting times. Obviously, just trying to keep the patient flow going, making sure patients that have got emergencies are getting seen, and also making sure that if things are being diagnosed, that we can try and get the patients back in as soon as possible to get their treatment completed. We like to provide information to patients in appropriate formats. Now, appropriate is dependent on the patient. Some patients might want a discussion, some patients might want leaflets, some patients might need a customised letter sending out to them, and again, that assessment needs to be made on an individual basis. We need to maintain clear communication, engage patients in decision making, so basically getting patients through and making sure that they know what they've got that they're presented with, what some of their options are, basically the benefits and the disadvantage of each option, and allowing them to make the decision on which treatment platform they'd like to go with. That's part of that offering choice wherever possible. It's obviously really great to build relationships with the patients, so find out a little bit about them, what they do for work, what kids they've got, what if they've got dogs, etc. like that. Obviously, the relationships just basically help that whole engagement with the patient, and again, forms part of that decision-making policy too. We of course want to provide a safe, high-quality dental care, and we can do that basically through good teamwork. We need at the minute, especially with the COVID scenario, patients do want to feel safe, so they want to come into the practice and they want to feel that we've got our infection control really tickety-boo. So that's basically patients coming in, they can see that we're taking time, we're still engaging with them in terms of making sure that the hands are in the hands, they can see we're wiping down banisters, etc. And when they come into the surgery, everything's really clean and tidy and it looks like a safe environment. Sometimes patients want to speak to things in confidence. Now, with reception, the waiting room's been open, this might not always be appropriate. The surgeries obviously are always with closed doors, basically with just a nurse, so we can obviously talk to a patient in confidence. However, if there's an extra event somewhere that a patient wasn't actually in the surgery with a dentist, a private conversation could be held, say for example in surgery 3. Now occasionally a patient would have to be refused access to the practice. Now why would we refuse a patient? Well, that only comes down to a very few things really. It'd be unacceptable behaviour, physical abuse, verbal abuse, race, gender or any other form of discrimination or unreasonable behaviour from the person. It could also include fraudulent or criminal behaviour such as stealing. Now, if that's the case, what would you need to do next? So the first thing you need to do is report the incident to Nicola, who will decide if the police need to be informed. The patient would be asked to leave the premises immediately by management, and the incident will be discussed within management, and the patient will be informed verbally and in writing of the outcome of this meeting. Now, occasionally the relationship can break down between a dentist and a patient, and the dentist may no longer feel capable of providing care, and the patient would actually be better treated elsewhere. If this was to occur, we would have to inform Nicola, who would consult with dental protection, and then from that, Nicola would arrange a meeting with the patient to discuss the difficulties that have been found. The outcome of the meeting would be followed up in writing to the patient, and the patients obviously will be informed of the decision to remove of access and explain the circumstances for this decision. Now, as for patient complaints, as you're well aware, we actively seek feedback from our patients, both to improve our service, but also to resolve any patient discontent prior to a formal complaint being made. If a verbal complaint is made, we would aim to resolve that within 24 hours, and if a complaint was made in writing, within 3 days. Now, any complaint that we received will be fully investigated, and then once we've basically done that, we provide a clear response to the patient, trying to summarise the patient's concern and offering some practical solutions wherever we possibly can. If a patient doesn't feel that we've handled their complaint acceptably, or they're not happy with the resolution, then obviously the patient would likely contact either the GDC or the CQC. Now for treatment plan and estimates, we obviously need to still meet the GDC standards on patient communications and consent. Every patient is assessed individually and are fully informed of the treatment decision making, and this is recorded in the patient's records. Before any treatment is started, a written treatment plan should be provided. And if there's any modifications to the treatment plan as we're going along, obviously we just need to make sure we've consented with the patient for any changes there, both basically the treatment but also any cost changes too. As a bit of advice in terms of treatment plan, obviously it's well worth making sure that patients are aware of the lifespan of treatment. Some treatment's got a really good prognosis, some maybe is a little bit guarded, but obviously it's just making sure those expectations are correct before the treatment's commenced. Clinical effectiveness and evidence-based dentistry. Now, wherever possible, we want to try and use evidence-based dentistry to allow us to choose which is going to be the right patient's choice, and hopefully guide the patients into what's going to work best for them. Now, in terms of guidance that's available, we've got things like the Delivering Oral Health Toolkit. That gives us great advice on prevention, including things like diet, on fluoride toothpaste in the home, but also fluoride application throughout the year at the practice too. We've got things like the NICE guidelines, which cover things like wisdom tooth extractions. We've got the Scottish guidelines for antimicrobial prescribing and anticoagulant management. We've also got the faculty guidelines for radiographic frequency. When it comes to appointment book management, patients have got plenty of options in terms of getting appointments. They can phone through, they've got a texting service, they can email through, and basically we try and remind the patients of appointments up to 3 days in advance before. If a patient's unable to make an appointment, we try and get them to let us know as soon as possible so we can reallocate the space. If a patient gives us less than 48 hours notice, we do obviously reserve the right to charge the patient. If a patient charge is made and the patient isn't happy about it, it's obviously really important that we need to forward that across to Nicola to look into. As for referrals, again, it's part of the GDC standards as well as the legislation within the CQC. Referrals can be made either to a team member in the practice or actually to an external practitioner with specialist interest, or maybe someone on the specialist list. We generally refer out to somebody else because we feel that the treatment's maybe not within our knowledge or our professional competence, and we just feel that basically the patient may be better off being seen by another individual. Before a referral's made, we need to basically explain to the patient why we're making a referral. Some of the waiting times and practicalities are basically where they're being referred to, and just making sure we've obtained consent from the patient. Once we've done that, obviously we need to just write that in the patient's notes. From a referrals perspective, if you receive a referral, obviously only accept a referral if you feel adequately trained and competent to carry out the treatment. If you feel it's a little bit out of your scope of practice, then obviously you've got the ability to refer on to another practitioner. Any external referrals are done via letter, and for digital we send via the NHS email. All referrals obviously just need to include name, qualifications, address, email address and telephone numbers of the referring dentist. Non-urgent referrals we'd aim to send within 10 days. If it's urgent, obviously it just wants to be done as soon as possible. With urgent referrals, we would look, or Nicola would look basically to ensure that the referral has been received, to make sure that the relevant care pathway has been activated. Obviously the patient can be provided with a copy of their referral if requested. Sepsis. Sepsis is a pretty rare condition, but obviously very, very serious. Normally patients that are not responding to oral antibiotic treatment or can't have their infection drained at initial appointment would obviously be trying to seek emergency treatment at the hospital. Kind of the signs of sepsis that we're looking out for is an altered mental state, malaise, shivering, muscle pain, failure to pass urine in the past 18 hours, breathlessness and increased breathing, increased heart rate and blood pressure, and non-blanching rash, cyanosis of skin, lips or tongue. So obviously if any of those, the patient needs to be seen urgently in the hospital. Okay, a little bit about prevention. The practice obviously does utilise the Delivering Better Oral Health toolkit, and that basically goes into a few different risk factors for the patient. Now, things that we're trying to promote in the practice, we want to make sure the patients are aware of the benefit of fluoridated toothpaste. Some patients sometimes use an organic toothpaste which doesn't have any fluoride in. We want to promote a healthy diet, and that can be in line with the Eat Well plate guide. We check with patients whether or not they are current smokers or not, and hopefully offer a little bit of cessation advice, and ideally signpost them into a pathway where they can get some professional help with quitting. We also basically assess alcohol use, again looking for whether or not there might be a little bit of dependence there, or whether or not there might be full abuse, and hopefully again just helping the patient find the right help for them. We screen patients for early signs of mouth cancer. Obviously the sooner cancer is found, the easier it is to treat, and also the prognosis of the patient is significantly higher. We also basically advise patients to wear mouth guards for things like contact sports such as rugby. Now, general advice at the practice, and we all do this, it's basically providing advice on toothbrushing, self-care for plaque removal, fluoride, diet, alcohol consumption and smoking cessation. And obviously forward on to the relevant people where it's in the best interest of the patient. We check as much as we can to try and pick up early disease, and that'll actually include things like a BP as a screening tool used on children. Patients' oral health and general health are assessed at checkups, and if basically it comes out that there's an undiagnosed medical condition, we want to basically get in touch with a relevant general medical practitioner or even a specialist at the hospital. Any updates in changes to the prevention and public health policies obviously done via team meetings, etc. Now, last little bit is on whistleblowing. Now, in the practice we encourage openness and ensure we put the safety of our patients first. Now, sometimes you might need to raise a concern. Now, that could actually be your own health or performance, and basically you want some help, a little bit of direction, and basically guidance on how to improve. It could be on the health, behaviour or professional performance of a colleague. could be any aspect of the environment where treatment is being provided. It could also actually be someone's asking you to do something you feel conflicts with your duties to put your patients first as well. Now, if there is a potential for whistleblowing, the main thing is that you act on it. You need to come and see myself or Nicola, although if it's not appropriate to raise a concern with ourselves, you could obviously consider the CQC or the GDC as well. If the concern is in regard to the safety of a vulnerable adult or child, the safeguarding policy obviously must be followed. Any concerns that's basically raised will be dealt with quickly, and accurate records will be recorded throughout the investigation. Your confidentiality will be maintained, and obviously we'll give feedback on what the progression of the investigation has done and the outcome of that. Last little bits on fitness to practice. Now, throughout a career, healthcare professionals need to maintain their standards. Now, this could basically be through things like CPD, private study, attending conferences, seminars, meetings and appraisals, and it can also just be informal discussions with other colleagues too. Now, where the standards of performance have been called into question though, sometimes this can be through either observation, complaints or appraisal. The professional body such as the GDC may need to basically step in and provide advice or guidance. Normally that's in the with things like mentoring, but as a final resort, that could be things like deregistration to the individual. Lovely.